You know, there's been an evolution in techniques and technologies of the last decade that's led to quite an increase in endovascular procedures and a reduction in the rates of major amputation. The one thing we really don't seem to have is any consensus regarding the best treatment algorithm. And to add to the mix, there are now 2 new drug-coated balloons that have been approved for use. We are here at TCT talking about one of the late breakers, which is going to be up online at JACC. And so please go to the paper and read Sustained Durability of Treatment Effect Using a Drug-Coated Balloon for Femoropopliteal Lesions, 24-month results of IN.PACT SFA. To talk about that, I'm with Dr. John Laird, who is Professor of Medicine and the Medical Director of the UC Davis Vascular Center. First, before we get to the specifics of the trial, where are we in terms of treating these patients where we really need to be talking about a new approach with these new drug-eluting balloons?
Yeah, the challenge has always been infrainguinal interventions where the results with our endovascular therapies have never quite been as good as we'd hoped. The SFA is one of the most heavily diseased vessels in the body. Diffuse disease is the rule. Total occlusions are very common. Often the vessels are calcified. There's a lot of disease in the infrapopliteal arteries. All of this negatively impacts, the results with our endovascular therapies, and we've struggled over the years to find a treatment that would be durable and sustained.
Now, IN.PACT SFA is what we're talking about. What did the investigators study originally and those initial results before we talk about what's new?
Well, the IN.PACT SFA trial was a randomized trial of a drug-coated balloon, a paclitaxel-eluting balloon, compared to standard balloon angioplasty in the SFA and proximal popliteal artery, working basically with the IN.PACT Admiral balloon. It was a trial that was randomized 2-to-1 between drug-coated balloon and standard balloon angioplasty. The 1-year results did show significantly better outcomes when a drug-coated balloon was used, with significantly better primary patency, but also a very low need for additional interventions, what we call target lesion revascularizations.
Now, in JACC Online Before Print, we have the results of what you're presenting here. What are you looking at in these 24-month results?
Well, there's been a paucity of data regarding longer-term outcomes with drug-coated balloons, and there have been a few studies where the longer-term results were disappointing with later restenoses or catch-up phenomenon. So what we wanted to look at was what are the 2-year results with this particular paclitaxel-eluting balloon. And what we found was that the effects of the paclitaxel were sustained and durable, and there was persistent to benefit at 2 years with better primary patency, 78.9% versus 50.1%, and also much lower need for additional interventions, 9.1% versus 28.3% with standard balloon angioplasty.
Now, one unexpected finding, and it was kind of a gulp moment, I'm sure, was a higher mortality rate at 24 months in the drug-coated balloon group, but you looked at that very carefully.
Right. There was a statistically significant higher all-cause mortality in the drug-coated balloon group. However, the blinded clinical events committee looked at all of these deaths and found that none appeared to be device or procedure related. There were no actual limb-related mortalities. When we looked at each of the mortalities, they were the typical things that these people die from: heart disease, sudden death, cancers, infections. There's really no signal that it was at all related to the procedure.
And oddly enough, the 24-month mortality rate in the angioplasty group was unusually low.
Very low. Yeah, it was
0.9.
0.9%. And when you compare that with some of the other trials in this space, particularly similar patient population, claudicants with mild to moderate reduction in their ankle brachial indices, mortality rates usually in these trials range anywhere from 3 to 11%. So the 0.9% was really remarkably low, and that's kind of drove the differences that we saw in all-cause mortality.
So now that there is some long-term data, what do you think? I mean, in the conclusion, you talk about the fact that the local delivery of paclitaxel may have the potential to change the treatment paradigm for patients with symptomatic femoropopliteal disease.
Yeah, I think there's a lot of interest in treating the SFA or popliteal artery without having to leave a permanent implant, a stent in place, because that potentially could lead to late problems of stent restenosis or stent fracture, potentially burn some bridges down the way. So there's a lot of interest in a leave nothing behind strategy, and what we've shown here is that you can have a very effective leave nothing behind strategy with a drug-coated balloon.
And this is really the first prospective multi-center randomized trial of peripheral artery devices in which a subset of patients underwent serial 6-minute walk tests.
Right.
And what did you find there?
Well, that's an area where the literature is really pretty weak when it comes to functional outcomes after endovascular therapies. And so a subset of patients in this trial underwent 6-minute walk test, and we did show a significant improvement from baseline in distance of these patients were able to walk after both therapies, really. And there was no real differences between patients who got treated with a drug-coated balloon or standard balloon angioplasty, but that similar level of functional improvement was achieved with 58% fewer reinterventions in the drug-coated balloon patients.
I mean, we've been following this topic for some time, but there's still more to come, right? There's an IN.PACT global study that is ongoing. What's being evaluated there?
Well, most of these randomized ID trials have, kind of a narrow focus in terms of treating patients with shorter lesions or medium-length lesions, not sort of the real-world types of patients that we see in practice who have 20-centimeter-long occlusions or very diffuse disease. So the IN.PACT Global Registry is basically a real-world type of registry where we're treating more complex disease, patients with long lesions, there's a long lesion subset, patients with in-stent restenosis, and patients with chronic total occlusions. And so getting a sense for how well the drug-coated balloon works in these really complicated lesions.
In the future, I wouldn't mind you coming back and chatting again and telling us where we're at.
I would love to.
And we have, this is the, Dr. Laird's paper we're talking about is IN.PACT SFA, and by the time you're seeing this, it means the embargo is passed. Please go online and check and read the paper yourself. For Cardiol Source World News, I'm Executive Editor Rick McGuire.